My name is Dr. Lindsay Ogle. I'm a family medicine and obesity medicine physician. And today I have Nikki, who is a registered dietitian with One Bite Nutrition. And we are going to be talking about nutrition and how it relates to heart health. So before we get into a couple of questions that we have, I would love if you just take a moment to introduce yourself.
Yeah, like you said, my name's Nikki. I've been with One Bite for, I want to say 3-ish years now, maybe
Wow.
4, on going on 4. I've been a dietitian for 5 years, and I just really enjoy being able to help people with their nutrition goals, and that's why I'm here.
Love it. Absolutely. Well, you're the perfect person to have on to talk about nutrition and how it relates to health, but specifically heart health. So we'll just start with how does diet impact someone's risk for heart disease?
Yeah, so multiple things in our diet can affect that, right? Whether it's affecting our cholesterol, blood pressure, inflammation, all of those are going to play a role in heart disease, of course. So we have diets high in saturated fats, trans fats, sodium, and added sugars. All of those can increase our risk for heart disease.
Absolutely. Well, spinning off of that, we hear about good fats versus bad fats. Um, do you have kind of a thought on that or what you help patients with to conceptualize that? Or is that even true or is that a myth? What are your thoughts?
Yeah, people love to put the label of good and bad on different foods. That is for sure.
Mhm.
Especially when it comes to fats. I think that we've heard that for years and years of good fats, bad fats. So those good or bad fats, they are those saturated fats that we just talked about in that first question there. They're mostly going to be from animal sources. And these are the kinds that we do try to limit for heart health. And then the good fats, those are going to be referred to the unsaturated fats. Those are going to be mostly from plant sources there. And so a lot of times when I work with patients, we look at not necessarily calling them good and bad, just ones to limit and ones to try to include instead of the ones to limit.
Yeah, absolutely. I love that. And I think I totally agree. Labeling anything as good or as bad can lead to, I think sometimes poor relationships with food or, whatever we're referring to. And I think just the human mind likes to have black and white thinking. That's our default. And we think in extremes. And really, in reality, nothing is 100% good or 100% bad. And so I really like that approach.
Yes, 100%. All right, we have a lot of nothing has to be taken out completely. Just if we can moderate things, add in stuff that may be a little bit better for us and try to limit the ones that maybe aren't so good for us, or again, just not have them all the time or watch how much we're having them.
Yeah, yeah, absolutely. Okay, do you have any go-to foods for improving heart health?
Yeah, so kind of exactly what I just said, right? That variety is what we kind of got to keep in mind there. Again, looking for low in saturated fats, low in those added sugars, low in sodium, and then we have that fiber role in heart health as well. So adding in that fiber, we can help again decrease the risk by improving those cholesterol and the blood pressure levels as well. Again, what can I add to my diet is a lot of what I like to focus on too. And so if we can focus on fruits, veggies, whole grains, lean proteins, these are going to check all those boxes that we just talked about there. Again, those fruits, veggies, whole grains, those are those sources of fiber that we usually miss in our diet, at least day to day diet, right? We might be really good on some days and then some days not have any at all. So if we can slowly work on adding those in day to day, that's a really great place to start. One of my kind of first items that I look at with patients is to experiment with adding like veggies to dinner, even if it's just to dinner. Right? Am I going to add them into a dish or am I going to have it on the side? How do I like to eat those veggies? Because I definitely want people to learn how to enjoy what they're eating as well.
Yeah, there are so many things you said there that I absolutely agree with. I love the idea of focusing on adding to our diet or nutrition plan rather than restricting, as much as possible. It just psychologically is so much more beneficial. And I think once people have some practice with that, especially adding in, lean proteins and fiber, you really see that you just naturally become more full and it can help with portion control. And then it kind of takes the place of some of those foods that may not be as nutritious or, might not be the most ideal foods to reach our health goals. So I love that approach. And I also really like how you said, finding something or like choosing one meal a day to focus on, even. So, dinner, oftentimes that's the meal we have, if we're sharing our meal with the family. And so it can encourage other people in our family to add on that nutrition. And so instead of just saying, I'm gonna fully, haul my whole diet and, do a full, whole 30 or something like that. Let's just focus on dinner. Let's add a vegetable. Let's pick something that we are probably going to enjoy. And I think that's key as well. I mean, not everybody is going to like green beans and not everyone's going to like Brussels sprouts, but you can find what you like and make it in a way that is a much more palatable and enjoyable for you. So I'm sure you kind of go through those options with your clients and patients and um, kind of help explore those possibilities with them.
Yes, 100%. We always, or I always go in with, okay, we can take those baby steps and still get to where we want to be in the end. And it's
Mhm.
usually a lot easier mentally and physically to do it with those baby steps of a little bit at a time. And like we said, once you find out that okay, by adding these things, I can stay fuller for longer. It can help curb those cravings later on. A lot of people are more willing once we have that one positive experience. Usually we are good to go and we're at our goals in no time.
Yeah, yeah, just get the ball rolling. That helps so much. And um, whenever I talk to a dietitian and fiber gets brought up, I always like to, pick your brain about tips and tricks because fiber definitely seems to be the thing that many of us are, not getting enough of. And like you said, our day to day. And it is so important for our overall health, for blood pressure control, blood sugar control, helps us stay full, good for our gut health. There are so many things that fiber is helpful for. And so, whenever I have the opportunity, like I said, to ask, do you have any like recommendations or like tricks to increase fiber intake?
Yeah, so kind of like we talked about earlier, of how can I take what I would normally make and add to it, right?
Hmm.
And so if I make muffins for everyone for breakfast for the week, how can I add some sort of protein to it? How can I add some sort of fiber to it? And just recently, I started adding chia seeds to our muffins in the morning. Again, is it going to be a huge difference? Not gigantically, but it's still going to add up throughout the week as well. And a lot of times with clients, I like to look at, okay, if I'm having a fruit for, breakfast and lunch and a veggie with lunch and dinner, I should be good. Like I'm going to get some in throughout all of those meals there. Or even if, maybe lunch doesn't always happen, maybe we add it in for a snack later on too. And so, sorry. And so finding those ones that again you do like, I think that's the biggest key of okay, I know that I really like apples. I could always eat an apple with my breakfast and then maybe later on for a snack too. Awesome. Great. Right, we're going to get some great fiber in there. So finding what works best for you. And sometimes that does take a little bit of trial and error to find as well.
Yeah, perfect. And that's great. That's interesting that you bring up the chia seeds for breakfast because I've done the same thing, but adding to my Greek yogurt that I have. Because I did, a little bit of a nutrition tracking for a couple of days and realized I'm not getting enough fiber. And so that was one thing that I did was add some chia seeds to my yogurt in the morning. So I do hope that does make a difference in the long
Yeah.
run.
They're very versatile. When you have something like chia or flax, right, you can add them to something like yogurt. You can throw them in muffins. You can even mix them in if you're making like a pasta or a quinoa dish or something like that.
Mm.
And most of the time you don't notice it unless you want to notice it and you want to use enough of them to notice it.
Yeah, that's great. That's interesting for like the pasta. I might have to try that.
Yeah.
Thanks. Um, along the path of, talking about different diets, is there a particular diet that you recommend specifically for heart health, like a named diet that we have?
Yeah, so it's definitely no secret that there are a ton of diets out there. And some of them will promote heart health, but they might not actually encourage that heart health there, right? And so usually the ones that I would recommend if we're wanting to stick to like a certain diet plan would be Mediterranean or DASH, or we also have the Mind diet, which is a combination of Mediterranean and DASH. Both of these are, focusing on those whole grains, fruits, veggies, and lean protein sources. And they do have a lot of studies backing them up that these eating patterns are beneficial for decreasing the risk of heart disease.
Yeah, absolutely. Totally agree. Yeah, I talk about the Mediterranean diet fairly often. Um, I do a lot of weight management, and it's not necessarily, a diet or a pattern of eating that's going to lead to weight loss for most people, but it'll lead to improved health. And that's ultimately, as a physician and a dietitian, what our goals are for our patients and clients. And so I think that's a great one. Like you said, has a lot of um, science to back it up. The mind diet, I actually haven't heard of that. I don't think that's the combination, which is really interesting. So I'll have to look into that specifically.
Yes, it is a newer one that's come about in the past 10 years or so. So yes, definitely look into it. It's a very interesting one that they're looking into for help with like Alzheimer's and dementia as well.
Oh yeah, so important. Okay, great. Yeah, I'll definitely take a look. What are your thoughts about a plant-based diet?
Yeah, so I feel like a lot of people tend to say, oh, well, I either need all of the protein or none of the protein. And that's where that plant-based diet comes in a lot. And it very well could help decrease those cholesterol labs. But again, that protein source, we need to make sure we are getting enough protein in still. Most of our traditional sources, especially in our country, tend to be from animal sources. And so we need to make sure that we're adding in things like beans, legumes, we have soy products between like edamame, tofu, all of that sort of stuff. We have to make sure that we're still getting in those basic macronutrients that we need, even if you do choose to not have, the higher saturated fat animal based proteins there.
Yeah, yeah, totally agree. I think that for the most part, any diet can be a healthy diet. You just need to be intentional about it. And that's where I think working with a dietitian can be so beneficial, even if it's short term. I don't know. I mean, I'm assuming you probably do both. You probably have clients or patients that you see for a few times. Maybe that's all their insurance covers. But then you also have people that you follow long term. I don't know if you want to share about, kind of those different approaches.
Yeah, so definitely. And what I try to do is, if we have access to that long term approach, it definitely pays off there.
Mhm.
I like to see patients about every couple weeks to start off with, unless, if there's some specific circumstances that we do need weekly. But about every other week, we set a couple and small goals, see what they are ready to start working on first. That's important. But
Mhm.
yes, whether I see a patient, once or twice, or I have patients I've seen for over a year, we are always having something that comes up that we can still continuously work on it. I think it's a perfect example that nothing's ever going to look perfectly, especially when it comes to our eating, right?
Mhm.
Like you said, right, we have these specific diet patterns we can follow, but is it going to be logical to follow them always? Like, can I always do this? Probably not, right? And so a lot of times it's nice to talk to someone, such as a registered dietitian, about, oh my gosh, this is coming up. What do I do? Help, what do I do?
Mhm.
Because we still need to look for those different things that are going to happen. And again, still being able to enjoy the food that we are eating long term.
Yeah, absolutely. I mean, there's a huge difference between, our ideological, perfect plan that we want to follow and then real life. And I think working with somebody, from the outside who has that perspective and experience, and seeing what has worked for other people, and bringing that, as a team and finding what fits best for you can be so beneficial. And we're probably going to, land somewhere in the middle of that, ideal plan versus reality of what is happening now. And it's a lifelong pursuit of health. And at no point, I don't think any of us arrive there, or like you said, we're not perfect all the time, which is totally fine. As long as we are making progress and taking care of our body and feeding it nutritious foods, moving it, sleeping, managing stress. 80% of the time, that's probably a perfect amount.
Yes, and like you said, right, I have patients who come in, okay, well, I want to lose weight. We might not lose weight, but we might
Mhm.
feel 100% differently than we did at the beginning of our process, right? Maybe my cholesterol labs are down. Maybe my blood pressure is down. Maybe I can sleep through the night,
Yeah.
right? And so I definitely think that right, weight is where a lot of people kind of get hung up on things where there's a lot of different ways that changing our nutrition can benefit our life in general.
Yeah, 100%. Yeah, your quality of life improves, and that is really what's most important. Um, great. Well, what if somebody has a family history of heart disease? Do you approach them differently or have different recommendations for them?
So 100% a valid a valid worry there, right? A lot of patients do come worried that my parents, my grandparents, and their parents, and their parents, and their parents, right, all back, they all have heart disease. What do I do? I don't want to get to that point, right? Encouraging a heart healthy diet is going to be completely fine for them too, right? It's not going to hurt them in any way. It can be, a treatment and it can be a prevention tactic as well. So we usually start working towards it, do small goals every day, right? Preventing disease versus treating it later on. I know that's what a lot of us are trying to work towards now.
Hmm.
But right, knowing that, especially with something like heart health, that sometimes your genetics can play a role there, right? We have that nature versus nurture going on. But in most cases, what we're doing, daily habits between activity, lifestyle, and eating, that's what's going to have the most significant impact on your heart disease risk versus that genetic side. Again, in most cases, there's always outlying factors there. But yes, if they're worried about it, we kind of go on the same track as I would for a patient who came with high cholesterol, with high blood pressure.
Absolutely. And 100%, if we, prevention is preferred over treatment. And so if you know you're at higher risk, then that is the time to establish with a primary care doctor, get your cholesterol checked, blood sugar, blood pressure checked, have your wellness visits, and then, definitely consider working with a registered dietitian to build in, those habits of healthy nutrition along the way. And then you can use, what you learned for the rest of your life, and to continue to help prevent heart disease. Well, great. Well, those are all the questions that I have. Is there anything else that you want to, share, knowledge tidbits that you have, anything you want people to be aware of?
Yeah, I think that's just that, it's never too early or too late to start on those habits. I have clients who are super young, in their, single digits, and then I have, 80 plus clients. And so it really just depends on what you are wanting from your life, right? What do I want to try to do? What do I want to try to improve that quality of life, like just like you said. And so if you're wanting to, obviously meet with a dietitian, of course we will be happy to see you. But of course there are tons of awesome dietitians out there as well. It's just finding where to start. I think that's the biggest one. Even if it seems super small to you now, it will add up later.
Absolutely. I think that's a great place to end. I love this conversation. Hopefully, we can have more in the future, and I hope people found a lot of benefit from it.